Let's do a hypothetical, okay? Using a fictional example. This is Dr. Patricia Blackwell. Now, decades ago, Patricia went to college to complete a 4-year pre-med undergraduate. This involved intense studies in the fields of chemistry, anatomy, biology, and physics, and she studied her ass off to pass the medical college admission test before even being accepted to medical school. For another 4 years of anatomy, biochemistry, pharmacology, physiology, and a whole lot more. She studied for and passed the United States medical licensing examination, then immediately transitioned into the next phase of her education, which was a 5-year residency with 16-plus hour shifts, and many of those shifts found her sleeping on the floor in the break room just to get some shut-eye between patients, sacrificing pretty much anyone and everything outside of the medical profession. But she still wasn't finished because she had another 2-year fellowship in her specialized field of surgical oncology. Now, this represents thousands upon thousands of hours committed to her education and training. Dr. Patricia Blackwell has been a practicing surgical oncologist for 26 years. She's also an atheist. This is Dr. Stephanie Frazier. She's a devout Christian. She believes in the literal healing power of Jesus Christ. She's a literal biblical believer, okay? And she prays for Jesus' healing all the time and believes wholly in his power. She is a person of faith. She is also a dentist. Now, this would be an interesting social experiment. I don't recommend it if you know someone that's going through medical trauma, but it would be interesting, would it not, to talk to the believer who has some loved one going in for a surgical procedure and say, would you trust more the believer, the person who holds to your all-powerful deity, who believes in the healing power of Jesus Christ, and you name and claim that healing? Would you hold to the dentist in the operating room, or would you rather an atheist who knew what the hell she was doing? In fact, for any surgeon in any context, how is the surgery without the prayer any different from the surgery with the prayer? At any moment, is there a doctor in the operating room and he looks up at the assistants and nurses and staff and he says, "Shit, we should have said the magic words."